Welcome everyone. Now, and we are talking about injuries around the hip in sports. Well, very commonly we use a term called muscle strain, and hip strain is very common in young sporting individuals who do stretching or who actively stretch their hips. For example, hockey or football or even martial arts, they can cause a lot of pain in the hip and the muscle strain, especially the flexor muscles front of the hip or the adductor group of muscles, which is on the medial side in the groin. Patients can suffer from severe pain to moderate pain in the groin or in the front of the hip or back of the hip. So they are usually coming to you for a muscle strain, but you've got to identify whether this is due to muscle strain alone or something else is happening. So it can be due to acute labral tear as well. Labrum is the lining of the acetabular component or the socket of the hip joint. The socket is like that, and the labrum is which covers the ball of the femur. So that is torn in many of the athletes, and that can cause recurrent pain, or repetitive motion can lead to a major tear, and they can completely stop their sporting activities due to the pain. Then there can be minor stress fractures in the neck of the femur, which can cause severe pain as well, and it is a chronic problem which can happen over years. Also, there can be other issues in the hip like early loose bodies in the joint, which can give you a clicking or a locking sensation. So these problems occur in a lot of patients who come to me who play football, hockey, or golfing, and even ballet dancers. They all can have this kind of problem. Acute labral tear is something which one should not uh, overlook, because they can cause severe damage to the joint, and subsequently repetitive injuries by playing sports can lead to early arthritis. And these patients, if they can come to you early, you can treat with a hip arthroscopy and remove the tear. So this is important to note that these patients require very early intervention, but many of these go unnoticed. So one needs to do an MRI scan in these patients and find out if there is a really muscle tear, muscle strain, or it's a labral tear in the hip joint. I also want to discuss one fact about the pain in the hip, maybe also coming from the spine, because sometimes the lower lumbar spine nerve can be irritated, which can cause pain around the hip joint. So one needs to really assess the patient thoroughly and then do the investigations to rule out these problems. So hip pain is a common problem in young sporting individuals who are in high contact sports or even low contact sports like golfing. So one needs to really assess the situation and attend your doctor, who can further do imaging studies and find out if you have any repairable or anything which needs to be done can be done at an early stage. Otherwise, people will end up in early total hip replacement in young age group. Thank you very much.